All right, I'm going to go ahead and get started. So again, my name is Tim Gibbs, Executive Director of the Academy DPHA and Director and Principal Investigator for Delaware Health Force. Welcome to Fall 2023, Delaware Mini Medical School. And we're going to call this the North version because there is also a Southern series that we're doing in Sussex and Kent counties. For your reference, https://delawareminimed.org is where you can go to view the videos after they've been edited and uploaded, where the PowerPoint presentations will be also loaded up for you to refer to. Moving on to the next slide. So this is a program that's run by the Academy DPHA. We were founded in 1930. MiniMed's been running continuously since 2009. It took a hiatus for a couple of years, but previous even to 2009, we ran Mini Medical School. This 2023 fall session is offered as part of Delaware Health Force Initiative of the Academy, and it's supported by state and local fiscal recovery funds through the Department of Treasury and the state of Delaware. So what that all means is that when the COVID-19 pandemic happened and the federal government responded with significant funding to address a number of needs, we applied for and were granted money to do things like Delaware Mini Medical School. And so let's talk about the purpose of this. First off, there are no tests or grade. However, for students who wish to join the Delaware Youth Medical Academy, there will be one final reflection paper due at the end of the series. That plus your attendance at every session amounts to you becoming a member of that academy. For those of you who attended Spring Mini Medical School, you'll be counted in that group as well, and we'll see how that all progresses. We hope we have some academy members at the end of this. This fall session, as I said, one of at least two sessions are going to occur between now and the end of the year. Interested students can absolutely attend additional series. We encourage you to. We're going to be doing different health topics and having different types of providers talking about their experience becoming a medical provider. And that is a goal here for you students, is if you're interested in a career in medicine, in dentistry, in research, in genetics, whatever, in public health, this is an opportunity to hear some people talk about experiences and also learn about the human body. There is no continuing medical education credit, no regular continuing education credits available. And as I said, participants attending all 6 live sessions will receive a certificate of achievement, and those who do a reflective paper will become a member of the Delaware Youth Medical Academy. So program goals, whoops, I went too far. Enhance health literacy in our community. That means health understanding. We want to expose middle, junior, and high school and undergrad students to a range of topics and types of providers. The Mini-Med instructors, 3 of whom are here tonight, will get to share their own career pathway with students and clarify how they got to where they are today. And then we want to encourage a dialogue between students and instructors in a safe setting, which is tonight, where you're not talking about personal medical issues. You don't have a healthcare provider coming at you with a needle for a shot. You're not at the dentist about to have a cavity filled. This is a safe space. We want it to be an affirming space. So starting off for this evening, we're going to be focusing on women's health. Hazel Morales Ayala, and I hope I said that right, is program coordinator in Women's Health Community Health Worker Program. She has been a member of Community Health since 2018, where she began as a health ambassador and quickly learned the need for advocates in the community. Hazel was part of the implementation and integration of community health worker programs at Christiana Care. Since then, she has had the opportunity to lead the work for Women's Health Community Health Worker Program, which we're going to learn about tonight. Cynthia Concepcion is a community health worker in the women's health program at Christiana Care. She supports mothers during postpartum, after birth, while their baby is in the NICU, the neonatal intensive care unit at the Women and Children's Center at Christiana Hospital. In the NICU, she connects families to resources and wraparound supports within their communities. And finally, we have Mike Feil, who has been with Christiana Care Community Health since 2019, when he first started his role as program coordinator. And in 2021, he was promoted to program manager. Before joining Community Health, Mike worked at the Language Services of Christiana Care as a staff sign language interpreter. And I will add, with some fondness and pride, that I started my career as a community health worker as well. And at this point, I will turn the screen over to Hazel, Cynthia, and Michael. Thank you very much.
Hazel, before you get started, I just want to say one more time, because there are some questions coming in. Please, if you have any questions for our speakers tonight, put them in the Q&A. Tim did mention a reflection paper. The subject of that will be given at the last session of this semester's worth of Mini Medical School. So do put any questions that you might have in the Q&A, and there will be no attendance check for this one. We're going to do it with the end reflection instead of an attendance check this time. Thanks.
Thank you. I'm still getting a error code saying host disabled screen sharing. So if you could give me permission to share.
Moment, please. Try now, please.
Okay, perfect.
All right. Thank you so much.
All right, can everyone see the PowerPoint?
Sure can.
Okay, perfect. So good evening, everyone. Thank you so much for joining tonight. Greatly appreciate the opportunity to be able to talk about community health workers here. And I want to thank everyone. Tim, thank you for inviting us. And I'm very happy to hear that you were once a community health worker. So I'm hoping that tonight we touch a lot of people so that the work can continue. So one thing I'm going to start by doing is, obviously, we already got introduced, so now we get to skip past that. But I am going to talk a little bit about what community health workers are. It is fairly new to some because, a lot of the work that's being done by community health workers before wasn't acknowledged as much as something that was part of the clinical team, right? And so now what we're trying to do in the state of Delaware is just really making sure that people understand that, yes, as much as things are needed in the clinical area, we also need the support of community members who have lived experience, who can support in a way of peer support to other patients or community members that are going through similar things to help them engage in their medical care, right? So talk a little bit about what there you go. So what is community health, our mission and vision? So you are going to hear me say community health a lot, right? And that one, it's in our name, but it also is the name of our department. And community health, their mission is to improve the health and well-being of our neighbors by delivering social care support, evidence-based interventions, and education. So what does that mean? It means that we are trying to make sure that the patients that we're serving get all their social needs met. But that also means that we have to show what interventions we're taking in order to accomplish these things. And then by education, similar to what we're doing tonight, educating people about what community health workers do, but also educating the community and the patients themselves on how to continue advocating for themselves and others. What our vision is helping our community thrive through radical access and holistical patient-centered care service. So what that means is that as community health workers at Christiana Care, we really are patient-centered. And that means that we try to figure out what is it that the patient needs? What is it that they want to work on. Because a lot of times what we have found is a lot of patients may come and say, I've been to my appointments and the doctor tells me that I need to get medication, but I don't have the money. And I don't have the money because I have to feed my family. So that's their goal, right? That they need to make sure that they have their basic needs met before they even start taking care of themselves. So really, the way that a community health worker engages with everyone is by asking them, what do you want to accomplish? What are your goals? We have had to kind of break it down to asking them, do you even know like what kind of goals you would even want to work on? Do you want something that is going to be just, something to do with you? Or is it something that you want for your whole family that will affect your whole family? So Cynthia will will also be able to tell you guys a little story about what kind of work she does and also a success story of the patients that we have served. So community health workers at glance, as mentioned, what community health workers at Christiana Care started in 2019, and I was fortunate enough to start with the implementation of getting the work integrated into the clinical settings. So what that means is that although we connect patients to resources in the community, we want to make sure that they are also coming back and getting the medical care that they need. We have different community health worker programs. Right now, we'll talk about women's health in particular, but we do have others who are in behavioral health, emergency department, primary care, school-based wellness centers, trauma department, and then women's health. And community health workers are essential members of the clinical care team. Although we are not clinical, we do not give any clinical advice. We're essential to making sure that we connect that patient back to their provider, that we teach the patient how to ask the right questions when meeting with their providers. No matter what the setting is, CHWs improve patients' health and well-being by helping them set and achieve self-identified goals and addressing social care needs. So as I mentioned before, we're really asking them, what do you need? And here are some of the resources, but we're also teaching them on how to do it on their own. We want to guide them, not do work for them. What are the program objectives? We identify and address social needs. How do we do this? One of the things that we do is what we call meet the patient interview / intake. But really what that is a conversation of what is it that you have lived through that has gotten you where you are right now, right? So a lot of the times asking them what their past experiences are, what it was like for them growing up, because a lot of the times conversations get the patients to, one, trust you, but also really express what it is that you that they need at that moment and how you can actually help them. And then we also do screenings. We do a screening called SDOH, Social Determinants of Health Screening, which basically goes over a lot of questions asking them whether they've had food, whether they've had any issues paying for their bills, whether they have gone to their provider recently. So again, doing a lot of the screening and asking what's going on at this point that we can address. We want to reduce health disparities. How do we do this? We do this by, again, connecting them to any resources that they may need, not only when it comes to medical needs, right? But for example, if they do need to get connected to a dentist, if they need to get connected to eye doctors, that's the opportunity for us to ask them, what is it that you need and how can we get you there? We refer patients to community-based resources. So although we are clinical and we do want to connect them to their providers, we're also connecting them to social services. We're connecting them to food banks and clothing banks to get them the essential needs that they have. How do we evaluate the program? One of the things is that we want to make sure that we connect all our patients to primary care. Although we're working with women's health, we want to make sure that after they deliver, right, they're still being taken care of. So we connect them to a primary care provider, if needed, a GYN, gynecologist, so that if they decide to later continue a pregnancy or have another pregnancy, that it's actually planned or worked on. As I mentioned before, we do our social drivers of health screenings. We also track the admissions and utilizations of emergency departments. So this actually does fall into our women's health, right? Not only are we tracking whether they go to regular emergency care, but if they're coming into OBGYN triage. So making sure that we're tracking who's coming in regularly. Is it because they are not going to their appointments, or is it just easier for them to just come to whenever they have an emergency? And obviously health outcomes. We want to make sure that they're attending their postpartum visits, that they are, if they had a medical need during their pregnancy, that we're able to work on them with that. Okay, I'm going to have Cynthia talk a little bit about our team. So these are the Women's Health Community Health Worker programs.
Hello, everyone. Good evening. I'm so happy to be here. I'll get right into it. My name is Cynthia Concepcion. As you can see, I'm one of our beautiful team in women's health. Our team, we create connections between vulnerable populations, the healthcare system, and the community state resources. We assist patients in the community and in clinical settings. So we'll help them attend not only connect to community resources, we also assist with joining them at their, if they wish, to join them during their medical visits in their provider's office. We help facilitate with the patient's healthcare and help navigate the social service systems with them, which can be daunting, just making a phone call, for whatever the resource is, even if it's just to make an appointment for WIC, it's troubling for some just to make that call when you're just getting a ring and no answer. Our team works out of the Newark Christiana Care Campus, with the exception of Ashley Dorsey, who works with patients out of the Wilmington Women's Health office. Blanca Sandoval works with late prenatal care and inpatient, and are inpatient for postpartum care at Women and Children's Center in Newark. Brandy Doxey and Ashley Dorsey both provide support for approximately 6 months during pregnancy, beginning around the 20-week mark. That's the 20-week mark, and then down through 3 months postpartum. Brandy works with patients out of the Christiana Women's Health office, and Ashley, again, she's out of the Wilmington Women's Health office. I support mothers during postpartum and that have had their babies admitted into the NICU at the Women and Children's Center. Jeray Jackson supports patients during pregnancy and postpartum. She assists in establishing prenatal care and provides support for poor birth outcomes. A quick patient story that I have that recently happened was I had a first-time mom with what's considered in the medical world advanced maternal age. She was 36 years old, or would be 36 at her delivery date. She had previously a high BMI and was diagnosed with preeclampsia early on in her pregnancy. She went into early labor, just entering her 3rd trimester on the 29th week. And after she was discharged, she found herself sitting at the baby's bedside in the NICU, not sure what to do with herself. She was down about her diagnosis and wanted to make a change to better her health. She didn't know where to begin. She had a pretty great support system at home, but of course, you're going through the NICU journey, so is your support system. So as I enrolled her and I began to engage and talk with her and provide emotional support, I noticed her concern was just trying to get herself, her eating habits in order. You're now sitting in the hospital and you're discharged from the hospital, so you're no longer being tended to. It's all about the baby. So I basically just, after listening to her, going to a few appointments with her and helping her just monitor her blood pressure, I researched in Delaware, and there's a program called the Healthy Heart Ambassador Blood Pressure Self-Monitoring Program, which helps adults get their blood pressure to a healthy level and keep it that way. And they help. It's a 4-month program. It's free. It's virtual, 100% virtual. And they basically focus on self-monitoring your blood pressure with individualized support They teach lifestyle techniques through nutrition, education, and cooking class during this 4-month program. And it helps, adults learn how to get into a healthier lifestyle and stay that way. So my patient, she pursued this, she engaged, she really enjoyed doing this. This was something she could do by the baby's bedside. And she did lower her blood pressure significantly, and she learned how to maintain that healthy lifestyle. So she went through it, but I just looked up to her and I said, wow, what an accomplishment. Yes, I helped you get to that point, but I admired her for just going through it and pursuing it and completing it. So that was my patient story. Hazel, do you want to go on to the next slide?
Yeah, of course. Thank you. So you may be asking yourself, what do the patient have to require in order for them to work with one of our community health workers? So as Cynthia mentioned, we do have different community health workers in different stations, right? But that doesn't mean that Cynthia can't go into the postpartum floor and help with them. So they're cross-trained. They can support any mom as long as they are willing to work with us. And I'll talk a little bit about that. But at Christiana Care, at least, right now, our eligibility for our Women's Health Community Health Worker Program is that they must be have Medicaid, Medicare, or uninsured. So if we do have a patient who is privately insured but later loses their insurance due to their pregnancy or loss of their employment, then we're able to always find a loophole, as I like to call them, to make sure that we connect them to some resource if it's not directly to our program. They must be past their first trimester. And this is just to make sure that we help moms who may be coming in late to their prenatal care, but making sure that they are past that danger zone of having a loss, which in OB triage, one of the community health workers, Jeray, she really works with the patient as early as 4 weeks, 6 weeks, as soon as they find out. So we try to make sure that we are supporting moms at every stage of the pregnancy. As Cynthia mentioned, her and Blanca do more of the postpartum, right? So they connect with the moms, and even though they're not receiving any ongoing prenatal care, we're making sure that they attend their postpartum care and that they continue taking care of themselves. Right now, we are asking that patients live in Newcastle County or Kent County, and that's in that zip code right there is Smyrna. Why? Is because as we mentioned, the community health worker program is able to really meet the patient wherever they are. Right now, a lot of our community is based off Newcastle County, so we want to make sure, just for driving purposes, for safety purposes, that our patients are within those zip codes areas. We also do home visits. We do, as Cynthia mentioned, we go out to their appointments if they desire to have us there. So again, we want to make sure that that's just somewhere where we can meet them easily. They must also have one of the following criteria: late entry into prenatal care, some type of chronic disease or mental health or substance use, have a BMI of 30 or higher, or any history of poor birth outcomes or at risk of birth outcomes. So again, we want to make sure we just have one of those, right? So what we have found is a lot of our patients have more than one. So they might have a high BMI, which causes them to have a higher birth outcome. So making sure that they at least fit one of those criteria. As I mentioned before, if they don't qualify for our programs, we do have other community health worker programs where they could be registered in. Now, one of the biggest things that I like to mention is that this program is voluntary. So one of the biggest things that we are asking is for the patient to be engaged in what we're doing with them. We can provide them all the services, and we can provide them all the resources and hand them numbers and everything. But unless they're willing to do the work themselves, it does become a little bit hard. So what I always tell our team is that we want to make sure that we're not telling the patients, hey, I'm going to call for you. If they have a language barrier, then we want to make sure, hey, I'm going to do a 3-way call. And so now they're engaged in that care, and now they're basically starting to get more confident on making these calls, on talking to their providers. That's also why I asked the community health workers to go into their appointments, right? In the very beginning, we want to make sure that that patient feels comfortable asking those tough questions that sometimes they don't really ever even think about asking, or they may just not feel comfortable. So making sure that we boost their confidence up a little bit, telling them like, hey, this is your care. This is what you need to ask. Here's how we'll ask. We can practice. So we really work with the patient depending on what it is that they want to accomplish. And again, if you don't know whether they would qualify for our program or other programs, I'm going to leave my contact information with Tim. That way, if anybody is more than interested to learn more about the program, the only other thing that we do ask for the criteria is that they must be seen at ChristianaCare. Only reason for is we have to have access to their chart, right? We have to make sure that we have access to documenting what it is that we're doing with them. So a lot of patients in Delaware do come to ChristianaCare. So that's where we, again, find our little loophole. Another thing we found is that we have a lot of patients who come from Westside Family Health. Although they're not receiving their prenatal care at Christiana, they deliver at Christiana. So that's our way with engaging with them. As Cynthia mentioned, what does the assistance really mean? We support during their pregnancy and then postpartum. So we can support them from 3 to 4 months postpartum. Again, if we feel like that patient just needs more support, we'll make sure that we get them connected to something for a long run. We send referrals on their behalf to community resources. And the way we do this is we have a platform named Unite Delaware, and we're able to electronically send referrals, but not only send them, but also follow them through and make sure that we circle back to making sure whether that referral was completed, whether it wasn't being able to met and we need to send it somewhere else. So it's a really nice way of closing that loop for our patients. We send referrals for baby supplies and essential needs. One of the things is our program doesn't necessarily have any of these resources available, but what we will do is, as Cynthia mentioned, look for those resources with our patients actively to get them whatever it is that they need. So a lot of the times we connect them to making sure they have somewhere safe for the baby to sleep. So we connect them to Cribs for Kids, making sure that they have a car seat so that when baby gets discharged, they're able to go home with a car seat. We work with the DMV to get vouchers for them to afford it a little bit cheaper. And we work a lot with the Food Bank of Delaware to make sure patients get connected to food resources. So again, there's a lot of things that we may not have readily available, but we make sure that we teach the patient how to get these resources even when we're done working with them. We provide in-home and in-person, I should say, community visits for support and well-being. We help the patient navigate the healthcare system. As Cynthia mentioned, a lot of the times the patients don't know what they are doing, right? They either don't trust the healthcare system, they've had bad experiences with the healthcare system, or sometimes they really just don't know what resources are out there. So what we want to make sure is help them navigate that system without them having fear of asking questions. So one of the things that we do is we make sure patients become comfortable with asking questions on how they can get the resource that they need. Before we do this slide, I want Cynthia, if you can just share a little bit about what got you here to ChristianaCare and how you started doing this community health worker program.
Sure. Let's see. So prior to 2018, I actually worked as a workers' comp claims adjuster, and I was good at it. But did I love doing it? Absolutely not. So in 2019, I felt the need. Something happened in 2019. Can't remember what it was, but in 2019, I felt I needed to change my profession. I wanted to be somewhere where I can be of help to others. I had majored in my undergrad as a behavioral science. So I said, you know what, let me just go forward and pursue my master's in my social work. I haven't finished it. I'm still working on it, but I'm pursuing it. So that's the key. In 2021, I basically sought out a role where I could begin doing the work of what I felt passionately about, which was helping others while pursuing my master's in social work. And that's where I found this community health educator role and in Christiana Care. And it has definitely placed me in a position where I just want more, I crave more. I crave and advocating for underserved individuals to receive appropriate services. I love being that connection between myself and providers, just letting them know, this is what the community needs. Maybe you guys can't hear it from inside, the offices and all the work they're doing, but hey, this is what our community is in need of. And, for them to be able to hear that from us, it makes a difference because it connects and they can say, oh, my patient missed all these appointments, what's going on? And it's not, they're not complying. And it's not that they're not complying. There's a barrier. There's multiple barriers that are stopping them from attending these visits. So coming in as a community health worker has just, opened my eyes to see that what people in the community are in need of. And even personally, like I could see things that maybe I couldn't see before, even with my own care. And I'm able to advocate for myself as well, on how to communicate within a medical setting, especially. So.
Thank you. Thank you for sharing. And the reason why I have Cynthia share this story is because right now, a lot of you have the opportunity to really choose what you want to do. Whether you decide to be a medical professional in any sense, I think it's really important for us to continue collaborating, right? So it's really important for us to make sure providers understand what community health workers are doing and how we can help, because we are there not only to teach the patient, but we're also there to teach, like Cynthia said, providers and really anyone who's willing to hear what we're doing, to let them know what impact we're having on our patients and how far they can get if they are being heard, if they are being really tended to when it comes to their social determinants of health, right? So that's another thing why I wanted Cynthia to say, you can be in any career path right now, but at any moment you can decide to want to do something different or just learn about different programs that are out there. I myself started off as a medical assistant, and I loved doing the work that I did as a medical assistant. I would face people and I would work with them. But as Cynthia mentioned, a lot of the times I was kind of like stuck where I couldn't do more. I was only there, I would see them for their appointment and I knew that something was going on, or sometimes they didn't come to their appointments. So when I originally came to community health, I started as a health ambassador, and they're basically our partners, health ambassador program. They're the resource, right? They're the ones that if we need a pack and play, if we need diapers, they're more of like the item people, I like to say. And I started off as that. And that opened up the opportunity for me to see what the need was in the community. So it just motivated me to continue learning more about community health, because again, it may not sound like it has anything to do with the clinical setting, but it has everything to do. Because if they are not doing well in their environment, they're most likely not going to come to their appointments, or two, they're most likely not even going to care if they come, right? They can come to their appointments and not even get the medications, even though the providers are prescribing them. So those are the things that we have to kind of reel back and say, hey, what's going on and how can we help them come to their appointments? Do they need bus passes? We can get them bus passes. Do they need help with prescription assistance? Hey, here are some GoodRx. Hey, there's also this program within the hospital that can help you fill that medication. So a lot of the times it's just asking the patient what's going on and how can we help you. I also started off as the program coordinator back in 2019. So it was a fairly quick transition. But as I was able to advocate a lot for what was going on with women's health. We have other programs in primary care, we have behavioral health, and we've expanded a lot within the last year and a half. We started off with a team of approximately maybe 30 individuals, and right now we're over probably 100. So it really has expanded. COVID was one of the things that really expanded everything. It showed the need of the community. So during COVID, we would do a lot of drop-offs, whether that was for food or if they just needed, some resource dropped off to them. COVID really put the spotlight on us, right? And showed how much of need there is in the community and why patients are sometimes very hesitant to come to their appointments. So it was definitely a tough time, but it also helped us a lot to become more engaged with our community, where we're able to do a lot of the vaccine events. We weren't obviously helping with any of the vaccines, but we were there supporting our community. And so that was a lot of trusting that came from that. I'm really excited for the work that we have done. I'm going to have Mike talk a little bit about this slide. And then Mike, I don't know also if you want to talk a little bit about what you did and how you transitioned over to community health.
Yeah, sure. Thank you. So for the health guides, there's with community health, we have the community health workers, as you heard tonight, but we also have other branches that are part of community health, health guides being one of them. And if you think about the clinical stuff that is presented with the doctors and nurses and the physician assistants, nurse practitioners, then we have non-clinical people within the hospital that work with patients, such as the community health workers. Health guides kind of work. They're not clinical, but they work kind of I would say they would work on like the back end kind of stuff, which is a lot of the insurance, financial assistance, questions about navigating through the healthcare system. If they don't know where to go, health guides would definitely be a good resource for them. They help with the medical legal partnership. If there's any issues going on there, the health guides will be able to walk them through that whole process. So we have the health guides, and then there's the social care connection center. Now, this is a fairly new part of community health, and we have social care connectors that are actually community health workers, and they work within the hospital on the inpatient settings. So patients that are inpatient, staying there for a few days or a week or whatever, the social care connectors will help with the discharge process. So they'll help with transportation after the patient is discharged. So as the patient's getting ready for discharge, the social care connector will help set up maybe a follow-up appointment to the doctor after they get discharged. They'll help with maybe scheduling some of those medical appointments, making sure the medicines are all set. So they'll work hand in hand with the doctors and the social workers and the nurses, just trying to make sure the patient has a safe and effective and efficient discharge from the hospital. This community health workers, which we've been talking about, and then the embedded social workers, I would consider these social workers are more on the clinical side because they have a little bit more training than what the community health workers have. And actually, most of our social workers have license to practice. So that would make them like a clinical personnel within the hospital. And they do kind of like some of the stuff that the community health workers do, but if there's something a little bit more complex, they would take that on. So if the doctor says, hey, this patient needs home health care when the patient's discharged, or they need some durable medical equipment like a wheelchair or a walker, they'll set up those orders and make sure that patient has those those things, which is the durable medical equipment, hospital bed or a lift, ordered, and make sure they have set up when the patient is discharged. Or if it's a service, they'll make sure those services are set up. They'll also help with like applications that are a little bit more in depth, like the long-term Medicaid applications, or DART paratransit patient, was in the hospital and now the patient really can't drive anymore. So, they'll help out with maybe a DART paratransit so the patient can get to and from appointments and social service appointments and things like that without having to rely on family or friends or anything like that to get them to and from. So those are what this embedded social workers do. And if you see social drivers, which is social determinants of health, social drivers of health, account for 80 to 90% of the health outcomes. So you have to think that, when a patient goes to see a doctor, that doctors are looking for maybe the patient to live a healthier lifestyle, right? Or the doctor is going to prescribe medication or rehab, physical therapy or something like that. So in order for the patient to really have a successful health outcome, they need to make some lifestyle changes, whether it's exercising more, eating better, or making sure they make their appointments, checking their blood pressure, checking their sugar, their A1C, when they do the sticks, right? So all that is part of like the outside. It's not done within the doctor's office. It's done outside in the community, in their homes. So that's the importance of the community health workers. So we help. The doctor says, all right, this is the plan for the patient. We want the patient to have a lower A1C, lower blood pressure. We help the patient and we guide the patient to help them with those positive health outcomes. And so social risk factors are if the patient doesn't have transportation, or if the patient doesn't have, lives maybe in the inner city where there's not really a nice grocery store where they have like a good selection of food and it's all maybe high sodium or something like that. Those are social risk factors that will maybe increase blood pressure or increase diabetes or not help them guide their healthcare journey to a more positive outcome. So that's when the community health workers step in and they help the patients, really guide the patients and help them find the right resources to really have those more positive health outcomes. So how I got into the medical field is I am not clinical, so I'm not a nurse or a doctor, but the beauty of being in the medical field is you really don't have to be. If you love science and medicine and just want to help people, even if you're not clinical, you still have a part to play in the hospital setting or a doctor's office. I went to school and I learned sign language, American Sign Language, while I was in school, and I helped start up the sign language interpreting program at Christiana Care years ago, and I helped make the on-call schedule, write the policies for all that, helped hire the interpreters, and I worked as a sign language interpreter. And at the same time, I was actually working in the patient relations field as well, the patient relations department. So I helped any patient concerns. I was able to kind of do some research and, again, positive outcomes, making sure the patient was satisfied. So I kind of had a dual role at that time. So I was interpreting and I was helping patients with any issues that arose within the hospital. I did that for a few years. I got my master's in healthcare administration, and then I left Christiana for a little bit and did healthcare sales for hospice companies and skilled nursing facilities. Genesis Healthcare was one of the places I worked, large skilled nursing facility company. So I did that for several years and kind of got back. And actually, while I was doing that, I was always an on-call interpreter at the hospital. Interpreters are really hard to, especially sign language interpreters are hard to come by here in Delaware. So they wanted to keep me on as an on-call interpreter. So I always had like one foot in the door as being part of Christiana Care. And then I came back after that. I came back as a full-time interpreter, and then I saw the position open here at Community Health, and I was like, this is something that I think I would like to help patients more, be out in the community a little bit more, and see how I can use the skills and talents that I've had and grown throughout my career, and help my coworkers and as well as patients live a little bit more healthier lifestyle and have more positive health outcomes. So that transitioned over to Community Health, and I've been here ever since. So thank you, Hazel. Turn it back
Thank
to you.
you, Mike. Yeah. And like you said, Mike, I think you hit a great point where you don't have to be a doctor or nurse to really be part of the healthcare system. One of the biggest things that we advocate at Christiana Care is everyone that is a caregiver at Christiana Care is a caregiver, right? So down to social workers to administrative assistants, they all put a little grain of salt into having all of this done. So it's really important that if you're looking into getting into the healthcare system, there's way more things out there that sometimes we don't even know about, right? So just attending these kind of seminars are very helpful because you get to know what's out there and what opportunities you may have in the future, right? Another thing that I want to mention is one of the things that I get asked a lot is what's the difference between a community health worker and a social worker? As Mike mentioned, social workers tend to do more of the very complex cases, but that means that we work hand in hand with them, right? So if we have a patient who in the beginning just needs a couple of resources, but later on becomes more complex due to their medical needs, then obviously we're able to work hand in hand with the social workers to get the patient what they need. The cool thing about the community health workers that not a lot of social workers get to do is we're out in the community. We're out at wherever the patient wants to meet us. One of our other community health workers, she's actually met a patient at a park to walk. It was 1 hour every week she would walk with this patient. And how did that help? That helped the patient lower their blood pressure. They were pregnant at the time. So obviously she kind of felt like, oh, I don't want to get up. I don't want to really do anything. I'm pregnant. I don't feel like moving a lot. But the community health worker was able to motivate that person by saying, hey, I'm going to meet you there. That's going to be like our home visit. That's going to be the time that we spend together. But we'll meet at the park and we'll walk around. And so she knew every week, like that was what the patient was looking forward to doing. Every week is just going on this walk to talk about what was going on and talk about the goals. Because I think a lot of the times we tend to just tell patients what they need, but we don't ask them, what do you want to work on? Another really good story that we have is another community health worker. She had a patient who was in a domestic violence situation, got her out of it, was able to help her get housing here in Delaware. And I will say, just disclaimer, we don't have a magic wand. We can't get people into housing like this. We wish we could, but we have the same resources as other individuals in Delaware, right? We just tend to call more and bother more and call until we get an answer. And so what she did is every day she would tell the patient, hey, call and I'll call, and we'll eventually get this application process. The good thing is that the patient had already done the application. She had already been actively looking for housing. So again, the patient's participation has a lot to do with it. We were able to get her into the house, but when the community health worker went to the house, she realized the patient had nothing, like no furniture, no nothing, no bed. She had a 6 or 7-year-old and a 2-year-old, and she was pregnant. And again, she was getting out of a domestic relationship where she was being abused, so she left with nothing. But to her, being able to be in a home, even if she just had an air mattress, that was her safe space. So with the help of the community health worker, we were able to put postings on Facebook Market and just ask for donations. And you'd be surprised how much the community wants to help. That was on a Tuesday. By Saturday, Sunday, she had her house fully furnished. She had a bed set for her 1-year-old. She had a bed set for her 6-year-old. She had a bed set for herself. She had semi-used couches. She had everything in that house. So it was just magical to see how much the community is willing to help when we ask in the right places. Once the patient delivered, she was still able to help her get into a CNA program. And right now she graduated from her CNA program, is working full-time, has her kids in childcare, and she's doing very well from when we first started working with her. Again, we don't have a magic wand. We wish we could. It's just a matter of perseverance, but also making sure that we work with our patients hand in hand. And I think that's it. That's all I have. More than happy to answer any questions.
Okay, good, because there's questions in the chat. So, the first question is, are there community health worker programs for those who have never had insurance? Yes.
So as I mentioned, a lot of times, specifically, I think primary care, this applies to, but even though they're uninsured, we are looking to help them, because a lot of the times it may be that they just don't qualify for insurance, but we can get them connected to the health guides where they can apply for any insurance. There's also financial assistance within the hospital at Christiana Care. So for the community health worker program in general, you don't need to pay. These are all free services. So there's no need for the insurances. The only thing about the private insurance is we don't tend to get a lot of patients who have private insurance, because a lot of those private insurance already have social workers and other people that can help them with those resources. So.
And this program that Christiana Care runs, the information on your slide, is that program called something? Can people look it up?
Yeah, community health worker program. And I can put in the chat, I'll put, we have a whole website actually with all the other community health programs. So we have, let's see, we have, why am I blanking out?
Because you're on the spot.
We have health ambassadors. We have youth education, Camp Fresh, which is a program that runs in the summer for children.
Food pharmacy.
Right, the food pharmacy. Thank you. So there's a list of things that we do, and I'll put the information about our department. We also are very big on having interns. Putting that plug out there. A lot of the times the interns will come just to learn a little bit more about our programs. We're also very happy to have people shadowing us. So, as long as they're within the healthcare system, we're able to work with them. But that was a great question. Thank you.
That is a great question. What credentials do you need to get a job as a community health worker?
That is a great question. None, really. Because what we're asking is for lived experiences. And what that means is that obviously we're okay with having people who have a high school diploma. I mean, I think high school diploma is really the biggest one that we're asking for. I know statewide, again, tonight I'm only talking about what we do at Christiana Care, but there's a whole initiative in the state of Delaware for community health workers. I know they're trying to pass some type of certification for community health workers from the state of Delaware. So really, we're just need a high school diploma and lived experiences, willing to just help our patients. And when I say lived experiences, sometimes you don't have to have lived that experience yourself, but if you know someone and you really have that passion to help others, that's really all we're looking for, is making sure that you know how to look for the resources yourselves, that you have advocated in the past for either yourself, your family, or anyone at work, anyone around you. And that's why I mentioned in the beginning that a lot of times community health workers had been out forever, right? And they were just called helpers in the community. No one actually gave them a name. And now the state of Delaware has realized that this is something worth paying for. This is worth people getting paid to connect people with resources. So we do have a lot of people who may have been very big advocates in their churches or in any community services that they've done before. That's really what we're looking for.
So we have 3 questions asking how old do they have to be to shadow or intern. So I think they're very interested.
Mike, do you know if they have to be in a specific program or anything like that?
I do not, but I do know if you go through Christianity Care Volunteer Services Department and let them know that you're interested in shadowing and spending some time with community health workers, they will, the Volunteer Services Department will get you hooked up with the community health department and we can work something out. And then also just to add what Hazel just said about what kind of experience you need, the Community Health Worker Association of Delaware, they are developing a curriculum that that has pretty much what you need to learn or what you need to understand as a community health worker. So most of the time when you get hired by either a Christian Care or another company as a community health worker, you're going to go through some kind of training and curriculum training on what skills you need to have and how you chart, how you document, how you introduce the program to the patients, how you how you make a care plan for the patient, because like Hazel was saying earlier, we really want the patients to be in charge of their healthcare journey, and we're just helping them and guiding them along. So so what you'll learn is how to work with the patient and make goals, and how to make sure that you're following up with the patient and making sure those patients are meeting those goals along the way. So all that's kind of like on the job training and classes that you'll take if you become a community health worker as well.
Yeah, the Delaware Academy of Medicine is working with the programs trying to put together the community health worker training program. So yes, I'm very well aware of that.
Nice.
All right. Let me look at more questions. So guys, those of you asking questions, how old do you need to be? There are links in the chat to both the Christiana Care Volunteer Services and the community health program that our speakers were talking about. So feel free to click on those because none of us know the answer to how old you need to be, but you can find all that information by clicking on the link. What is your biggest challenge working in the maternal space?
Cynthia, I think that one sounds like yours.
The biggest challenge is how little so many people know about the maternal, issues that that particularly women do undergo, especially in the space of when you get into Black maternal health. I think that's the biggest challenge, is because you're learning as you go and there are needs and barriers all at the same time. So it's just kind of being able to decipher what's important right now and for the patient, and kind of peeling it off little by little like an onion. So what may be important in my eyes, in my heart, to myself, I wouldn't be able to impose that on my patient. I have to rely on listening to them, communicating with them, hearing them out, what their needs are at that moment. Something as simple as calling to make a doctor's appointment, for anyone else may be easy breezy, but for some, it's a challenge. They may not have a phone to call and make this appointment. A lot of these establishments, we go in and they're like, oh, pull out your phone, you have to scan your QR code, and, not many people, there's barriers that people are not aware of, and they don't have access to a lot of the electronic, these electronic devices, smartphones and as such. So it's something as simple as making a phone call that I could say it's challenging for some, and us as community health workers, we're basically standing side by side our patients. We're not stepping in front of them. We're encouraging them. We're uplifting them. We're advocating for them, making sure that their voices, their needs are heard. So again, it's not what I think is important and what they should be doing. It's what they interpret, what they feel their need is, to put that in front and make them feel the importance of being able to speak up for themselves.
And I will add, sorry, real quick, I will add that, as I mentioned, yes, we can have all the resources available. One of the biggest challenges is the state of Delaware not having as many resources now. They're very limited. So I will put a plug out as well that if you're looking into, advocacy, that also could be something as simple as learning how to create asking for grants. So grant writing. There is a lot of communities that just need those grants, but there's no one to put those grants out for them. So that's also a great way to think about it, that not only are we there to do the work, but we also need to continue supporting maternal health in general.
So here's a question. Do community health workers only help pregnant people?
No. As I mentioned before, we have other programs in primary care, behavioral health. We have another program with violence prevention. So really anyone who's been a victim of gun violence, we're also able to support them. We have food pharmacy programs. So we're helping patients with any patient really that has some type of food insecurity. What else? As I mentioned, we have community health workers in the schools. So if you're in high school, you might have heard of the wellness centers. We have community health workers that are embedded in there as well.
How do you connect with those who can't access resources through technology?
I'll go ahead and answer this one. We're basically their connection to learning how. We initially connect them with the devices that we have. So we'll meet them at home, we'll meet them at libraries just to get them going. And our ultimate goal is to also check out resources where they can access, whether it's through the government, state funding, free laptops, internet, and even free phones, smartphones that they're able to do, everything that they need to do. We help them access that information, those devices.
Cool. How is the work environment as a CHW for Christiana Care?
I can.
It's like it can be stressful at times.
It definitely can be stressful. I mean, you're working with, a lot of different personalities as far as the patients go. Some are really good about their healthcare, just need a little bit of help. Some you kind of teach them from scratch on just the healthcare system and everything. But what's nice with the community health workers and the jobs that they do is the community health workers make their own schedule. So they're not stuck in an office all day. They're out in the community, on the campuses, at the hospitals and in the doctors' offices. They're making phone calls to patients. They're going to patients' homes. They're meeting the patients in the community somewhere. Some of them say, hey, I don't want you coming to my house, but we can meet at the nearby park, or we can meet at the library or McDonald's. So the community health workers are really out and about a lot during the day. It can get stressful as far as just maybe managing your schedule. It can get stressful when maybe you have a patient that you're trying your hardest to work and helping them trying to turn a corner to help them with their healthcare, but you're doing a lot of work, but then you see that they're not really wanting to participate, or they're not wanting to do the work they need to get up to where they need to be. That can get stressful and frustrating sometimes. But having said all that, as you heard from Hazel and Cynthia, there's a lot of good success stories out there as well, and that's really what makes the job satisfying. And Cynthia, do you want to add anything?
Yeah, I'll definitely add, with my personal experiences, when I first started navigating in the NICU, I didn't think I was going to make it because you're human and you become attached to these little babies in these big settings with all these connections and these machines. But as I continued, fearlessly my work, I could see the warriors that these babies are. And now I walk, by their rooms and I love to hear them cry. I love to see all the staff working with them and changing them and putting outfits. It's just, you have to see the optimism in everything. There's always something that could be sad and down and dreary, but just seeing how strong these babies are, that gave me all the love and the life to just pursue and helping, mom, rally up to make sure you're here for the baby. Do good for yourself so you could be here for the baby.
Yeah, I liked working in the NICU when it was a good day. Do you all partner with other organizations like Parents as Teachers or in conjunction with HOSA?
Yeah, I mean, like I said, we do presentations like this, not only internally, we really try to do presentations wherever they'll hear us. When it comes to partnership, as I mentioned, if the patient needs to get connected to further services, Parents as Teachers is one of the partnerships that we work hand in hand as well, especially for moms who, if they're only working with us up to 3 months postpartum, if they need those resources for a long term, it's great for them to get connected to other services in Delaware.
Great. One last question, it looks like, is being a CHW something you can be involved in if you already have a job?
I think community health workers are everywhere. A lot of us are community health workers. When it comes to getting paid for it, now that's different, but I think there are a lot of community health workers out there that don't know that they can get paid for. So I will say one of the biggest opportunities you may have is continue doing the work, volunteering, whenever, at least in our end. I don't know, Mike, if you want to add to this, but when we're interviewing for people, we're really looking for those experiences that they've volunteered places, that they've worked at places that will really add to what we're doing, right? So for example, if there's a lot of times where we have other openings, they may not fit directly with women's health, but if I think that they're going to do with primary care and a primary care position comes open a month later, we keep those resumes. We kind of keep in mind, hey, this candidate was very strong. Let's, we don't reach out to them, but we'll say, hey, are you still interested? Or they'll reach out to us. So there's always that opening of like making sure that if someone comes back and interviews for that position, we say, hey, we've already interviewed this person and we know that they'll be a strong candidate.
Yeah, we actually have a community health worker in the food program right now that she interviewed maybe once or twice for a couple positions that I had open, but there was a couple other people that were just maybe just better fit. But she herself did a lot with her church, so she felt like she was doing a lot of community health work with her church, doing helping with maybe the older population at her church, make appointments for doctors, making sure that they were getting transportation, helping with food. So she was doing some of the stuff that we do in the office already, but she wasn't getting paid for it. But now she has a full-time job and is getting paid for doing pretty much what she was doing on a volunteer basis. So yeah, absolutely.
Awesome. All right. That's it for questions. So thank you. I just want to say thank you to our presenters for coming. We really appreciate you coming and telling us all about what you do and what your joy comes from. I am going to share my screen for 2, maybe 3 seconds. Next week, we will be meeting right back here, same bat time, same bat channel. You can use the same link that you used to get to this week. Next week, we will start at 6:30 on October 11th, and we will be discussing physical therapy with a doctor of physical therapy. You will probably get an email the day before, like you did for this one, just reminding you of the link and everything. I encourage you to check out delawareminimed.org. That will have the recording of this presentation as well as the slides that were used, so you can, keep them for your very own. And it will have more information about the Academy, because I know a lot of you had questions. And I do want to encourage everybody to follow us on social media at the Delaware Academy of Medicine. We would love to have you join us on social media. We would love to have you join us as a student member. And with that, I think I will stop my sharing and I will say good night, everybody. Have a great night. And we'll see you next week.